I'm Elizabeth Nitz, and I would like to start by saying thank you for considering me for the Morrison Healthcare Dietetic Internship, and for taking the time to watch this video and getting to know me better. I live in Austin, Texas. I've been here for 20 years, and during that time, I've definitely established roots and developed decades-long relationships, both personal and professional, and that is the main reason that I chose Central Texas as my preferred internship location. I love Austin's commitment to health and fitness. I am inspired by its reputation as a technological and entrepreneurial hub, and so my first choice would definitely be to stay here in Austin, Texas. I've chosen clinical nutrition as my concentration choice for a number of reasons. I work well independently, but I really appreciate the interdisciplinary team approach that clinical nutrition utilizes and the opportunities that brings with it to learn from other professionals. That's something that I really look forward to. I'm going to move on to your other questions now, beginning with scheduling. My chief preceptor has let me know that I should anticipate schedule changes each week. And how do I respond to that request? Well, I respond by accommodating that request. I don't plan on working outside of my internship, and so I expect to have flexibility on my end to meet the scheduling demands required by both rotation sites and my preceptors. I do understand that there is a need to have a work-life balance, and I'm happy to say that in my past professional career, I've been able to maintain that just fine. So moving on to question 3, an adult patient who has recently started a tube feeding and is having profuse diarrhea. So there are a number of steps I would take to address this problem. First, I would have a conversation with the patient. I would check on their comfort level, imagining it's not very high, but ensuring them that we're doing all we can to improve their situation. And I would also let them know that this isn't anything to be concerned about, that in fact, diarrhea is a very common complication of tube feeding. So to get to the bottom of the cause, there are a number of things I would consider. First and foremost, medications, especially the use of antibiotics, potentially a C. diff infection, or maybe something with the formula itself. It's a hypertonic solution, for instance. So I would get to the bottom of the cause and then potentially consider a stool bulking agent, so maybe a formula that contained fiber to help to minimize the diarrhea. Next, moving on to Mr. Jones, a 50-year-old patient who has been hospitalized for heart and renal failure, who is on a low-sodium, low-fat diet, but has bacon every day and insists on having it on his tray. So I would again start with a conversation with Mr. Jones, and I would let him know I understand that having bacon is part of his routine. And so in addition to probably enjoying the taste, he's getting some comfort from it because that's just part of what he's used to and what he does every day at home. And so now he's taken out of his home, he's in a hospital, and as I mentioned, he's probably getting a lot of comfort just from having a small bit of his home routine with him in the hospital. So after that conversation, trying to express empathy, I would next move on to some education and counseling. And I would talk to Mr. Jones about the nutrition quality of bacon and how some of those nutrients, specifically saturated fat and sodium, are connected to heart and kidney health. So after that conversation, I would then ask him if there's any way he would consider not having the bacon. If he still insisted, I would talk about some alternatives, potentially like a turkey bacon, or even moving to have bacon every third day, something like that. Lastly, what do I think the role of a preceptor is and what are my expectations? So I think the role of a preceptor is to give guidance and training, to act as a mentor. From my preceptor, I expect help with goal setting and feedback, constructive criticism, and I also hope to convey to the individual my appreciation for them because I understand that they have a full-time job and a personal life, and so being a preceptor is really an individual going above and beyond. And without them, I wouldn't be an RD to be, so I really appreciate it. I want to thank you for your time, and I also want to say, speaking of RD to be, I want to share my digital portfolio with you, which is www.elizabethnitsrd2b.com. It's Elizabeth Nitz, RD, the number 2, and the letters BE.com. Thanks so much.